Hello, I'm Dr. Beech, and today I want to talk about a condition that is very, very common. It's called frozen shoulder. Frozen shoulder is a condition where the person is unable to raise their arm up. Sometimes they're completely stuck like this. Sometimes they can go up in a little bit or maybe up to 90 degrees, but they're unable to raise their arm completely in a 180-degree fashion. It's an extremely common condition. In general, it's seen more in females than males. I don't know why. But what happens is that really nobody understands what causes frozen shoulder. And in chiropractic, we would usually adjust the shoulder and do therapy on the shoulder to try to help it. And we do help it a lot. But recently, I discovered a technique that has been really amazing to me for treating a frozen shoulder. And I have to give all credit to a good friend of mine, Blaine Watson. Blaine is a Vedic astrologer from Canada who lives here in the U.S. now. And Blaine often sends out daily newsletters on different topics. And one day I got a little email in the mail with a video of a chiropractor in Australia or New Zealand, I can't remember which, who was showing a technique where he was treating patients who were coming in with frozen shoulder and adjusting them, and then their shoulder would be released. And when he explained what he was doing, I understood immediately why it worked, but I'd never put the two items together. Basically, what he was saying was that in the upper cervical spine, we have a nerve that exits from the brain called the spinal accessory nerve, which innervates the trapezius muscle and some other muscles of the shoulder. And he had discovered that if he adjusted the upper cervical area, in patients with acute frozen shoulder, that it gave them almost immediate relief, at least within a few visits. But even the first visit, they'd be able to raise their arm much more than they could in the beginning. And of course, all chiropractors know how to adjust the upper cervical area, but I had never thought in my 31 years of practice, I never thought of applying that to frozen shoulder. So then, interestingly enough, within a day or so, somebody came in with frozen shoulder, and I adjusted their up. I just said, before we do anything else, lie down on the table, let me adjust your upper neck. And I took a picture of them before I did it, and then adjusted, and then took another picture, and you'll see that picture now. So I wanted you to be able to see that picture and then take a look at what happens. Now I've taken since then, I've taken pictures of other patients with the same kind of condition. I'm seeing this over and over again. Let me show you a few of those. And this has been really a wonderful thing for my practice, that I can help patients with frozen shoulder so quickly. Usually within 2 or 3 visits, we have all of the motion restored. And again, I want to give thanks to Blaine for sharing that information with me. Now, I'm not sure how well this works for chronic frozen shoulder. I haven't had anybody come in who has truly chronic problem. Chronic means that it's been there for a long time. When frozen shoulder is chronic, then it develops adhesions, scar tissue around the shoulder, which is called adhesive capsulitis. And that, my guess, will be a little bit more difficult to treat. We'll have to do some rehab on the shoulder and break down those adhesions in order to correct it. But it does appear that frozen shoulder is being caused by a misalignment in the upper cervical area that's giving the initial problem. And it usually does just start quickly, which would be consistent with that idea, because a person might just sleep in a bad position one night, have the head turned or whatever, misalign this area, start to put pressure on the spinal accessory nerve, and then develop frozen shoulder. So I hope for those of you who might be suffering from this condition that this is good information for you. Hopefully For those of you who aren't, you never do. Take care.